My name is Anna Criswell, and this is my media clip final project. Throughout this course, we've learned about many different types of exceptionalities, and I'm going to go through the characteristics associated with each exceptionality and discuss how we can apply universal design for learning and differentiated instruction to better serve these students with exceptionalities and all students. I'm going to begin with learning disabilities. Students with learning disabilities generally demonstrate low academic achievement in one or more areas and have trouble learning and processing new information. They have specific trouble with mathematics, reading, and/or memory. Despite these challenges, students with learning disabilities typically have average or above average intelligence. Students with learning disabilities are more likely to experience depression symptoms, high levels of anxiety, and emotional difficulties, such as loneliness or bad behavior. Learning disabilities are often characterized by neurological problems and structural brain differences. The support we supply to students with learning disabilities can also be helpful to our other students, and one way to provide this support can be to present information before students begin to learn it by using advanced organizers. And one example of an advanced organizer is a graphic organizer, which helps students organize and process new material. Another way to provide support is to use more than one instructional method. Some examples of this include providing visual or graphic organizers to go along with oral presentations, incorporating models or demonstrations, and involving students by implementing every pupil response techniques. Students with communication disorders generally have difficulty producing sound, receiving information, and/or formulating information. Students with communication disorders have trouble communicating, and therefore they're at risk for having difficulties in social interaction. They may have difficulty recognizing social cues, initiating and maintaining conversation, or expressing their emotions verbally. They might also struggle academically due to the difficulties that they face as far as being able to receive information, understand information, formulate information, and then express information. Some ways to provide support for students with communication disorders includes using visual representations along with verbal information, providing graphics, and providing controlled vocabulary. We can also provide students with multiple ways to demonstrate their knowledge. So if we assign a project, we could give students the option of completing a written report, a PowerPoint presentation, or taping an oral report. Other ways to provide support include clarifying vocabulary and symbols, providing technological tools and assistive technologies, and minimizing distractions and background noise. Next, I'll talk about emotional or behavioral disorders. Students with these disorders may have an inability to build or maintain relationships, inappropriate behaviors or feelings, and/or a mood of unhappiness. And these characteristics can cause students to struggle academically. There are also emotional characteristics that these students struggle with, and these can include anxiety disorder, panic disorder, and mood disorders. Students with emotional or behavioral disorder may struggle with social interaction due to their tendency towards behaviors that are disruptive and aggressive and non-compliant. Intellectually, students with emotional or behavioral disorders typically have IQs in the low average range. Some ways to provide support for students with emotional or behavioral disorders include allowing them to use technology to self-regulate their behavior and academic performance, implementing positive behavior supports, and helping them to set behavior goals. Other options include classroom-centered intervention, service learning, and problem-solving instruction. Next, we'll discuss attention deficit hyperactivity disorder. Students with ADHD may experience limited strength, vitality, or alertness. They may have a heightened alertness to environmental stimuli, which distracts them and keeps them from focusing on the educational environment. This inattention and impulsivity interferes with their development and their functioning in school. Students with ADHD may have trouble with social interaction also because they struggle to listen when someone speaks to them directly. They struggle to keep from talking excessively, and they might struggle to avoid making careless mistakes. Students with ADHD are very diverse intellectually. They have IQ scores that fall all across the full spectrum, and they are just as likely to be identified as gifted as typical students. Some ways to provide support for students with ADHD include multimodal instruction, errorless learning, video self-modeling, and interactive instruction that keeps students engaged and focused. Providing opportunities for physical activities and verbal expression can also be helpful for students with ADHD and for all students. Next, I'll discuss intellectual disability. Intellectual disability is characterized by significant limitations in intellectual functioning and adaptive behavior. Students with intellectual disability struggle both intellectually and academically. They typically have low IQ scores and struggle with memory, generalization, and motivation. They typically also struggle socially due to problems with responsibility, self-esteem, language, concepts, and daily living activities. Some ways to provide support for students with intellectual activities include digital talking books like e-readers, community-based instruction, and using the self-determined learning model of instruction. Other options include optimizing autonomy, promoting expectations, and clarifying vocabulary and symbols. Next, we'll discuss autism. Autism significantly impacts communication and social interaction for students. Students with autism often resist change to environment and change to routine. They also experience sensory stimulation differently, and they often struggle socially because they experience deficits in social, emotional relationships and nonverbal communication. They also struggle academically because they exhibit problem behavior and have sensory impairments. Autism occurs in children with all levels of intelligence, but more severe autism is typically characterized by a low IQ score. Some ways to provide support for students with autism include positive behavior support, curriculum adaptations, learning to learn strategies, self-directed learning strategies, and keyword strategies. I'll now talk about traumatic brain injuries. Traumatic brain injury occurs when there is injury to the brain caused by external force, resulting in total or partial functional disability or psychosocial impairment, or both. Students with TBI differ in onset, complexity, and recovery. They often share similar characteristics with students who have other exceptionalities. Students who sustain a severe brain injury have increased rates of intellectual impairment. Their injuries decrease cognitive function and make learning more difficult. Students with moderate and severe TBI have an increased risk for problems in building close relationships, solving social problems, and recognizing emotions. Some ways to provide support for students with traumatic brain injury include using memory supportive technology such as alarms and reminders, daily planners, instructional pacing, and collaborative teaming. Allowing students with traumatic brain injury to take frequent breaks from learning can also be helpful. And next we'll talk about students with hearing loss. Intellectually, students with hearing loss do not have cognitive challenges due to their hearing loss, and their IQ range is much the same as students without hearing loss. But students with hearing loss struggle academically because they often have to use manual communication, and because our curriculum is so language-based, students with hearing loss often struggle with reading and writing. They often also struggle socially because They don't know how to communicate with students because generally students who don't have hearing loss don't know how to use sign language or communicate with students who do have hearing loss. So that can be difficult. Some ways to provide support for students with hearing loss include semantic mapping, the KWL approach, thematic organization, and Venn diagrams. We'll now discuss visual impairments. Students with visual impairments have a wide range of visual abilities, and they also differ intellectually, cognitively, and academically. They all have one thing in common: a limited ability to learn incidentally from the environment. Students with visual impairments experience different social interactions than their peers because they don't share common experiences with their sighted friends, so it might be difficult for them to maintain friendships. Students with visual impairments have unique academic challenges also, and they might struggle, but they can be academically successful. Some ways to provide support for students with visual impairment include experiential activities, tactile representation, braille resources, gradual fading of assistance and prompts, and repeated kinesthetic demonstrations. Lastly, we will discuss students who are gifted and talented. Children who are gifted and talented are children who are identified as possessing demonstrated or potential abilities that give evidence of high performance capability. People who are gifted and talented typically have one or more of the following characteristics: high general intellect, specific academic aptitude, creativity, intellect, leadership ability, and visual or performing artistry. They typically have IQs, and they may experience social problems due to stereotypes, bullying, or the isolation of a gifted program. Some ways to support the growth of students who are gifted and talented include providing instruction that matches the strengths and needs of each of them individually, offering opportunities for individualized responses, and enabling students to select and independently read high-interest books that are slightly above their current reading level. When it comes to teaching students with exceptionalities, there's a lot to learn, and this course has really helped me feel more confident in my ability to effectively teach students with exceptionalities.